Here's the scoop, and it is a big allegation. The provincial government rejected its own public health agency's advice and then told the public that they had been consulted. And one of the top executives at Public Health Ontario was so dismayed by this whole ordeal that she decided to go public, spoke exclusively to the Toronto Star, and then today many scientists shared her concern. As Toronto sits poised to become a red zone in Ontario's new COVID-19 framework, scientists are grabbing megaphones to warn they either weren't listened to or weren't consulted.
We had no consultation. We saw the framework when the public saw the framework.
Epidemiologist Ashley Toot is a member of the provincial government's modeling consensus table. She was instantly concerned when she saw Ontario's plan.
Basically, if we're responding at a point where we have that amount of COVID circulating in our communities, we are going to be in for a really tough time in terms of bringing things back under control.
It led a lot of people to wonder who Doug Ford listened to. Here's what he said last week.
This framework was developed in consultation with the Chief Medical Officer of Health, the Public Health Measures Table, local medical officers of health, and other health system experts.
In a bombshell Toronto Star interview, a member of the Public Health Measures Table, Dr. Shelley Deeks, said her advice was ignored. Her agency recommended the strictest red control level if the weekly infection rate was higher than 25 cases per 100,000 people. Instead, the province went with 100 cases per 100,000. It surprised Deeks, saying she's not in agreement with the current framework. She declined follow-up interviews, saying she stands by the reported comments.
I think it's really clear that we can't trust Mr. Ford. We can't trust the Minister of Health. We simply can't trust them. They made that very clear.
The opposition was expectedly angry, but even physicians are demanding transparency from the Premier.
No amount of spin can explain this. At his next press conference, we need the truth.
I appreciate the doc voicing her opinion.
Doug Ford said it was Ontario's Chief Medical Officer's call, Dr. David Williams.
This framework was given to us through Dr. Williams and his team, and we went forward with it. That doesn't mean, Rob, we can't change this. Nothing in this pandemic is concrete.
Few specifics, but an openness to change as Dr. Williams defended himself.
Input is always going to be taken in. We're always going to look at it, and if we have to make revisions, we would do so.
With the current threshold, only Toronto and Peel are in the red zone. But if the public health recommended threshold had been used, at least a dozen of the province's 34 health units would be in the red zone.
I think it has to be changed. I mean, at this point, I don't think it's useful.
And that epidemiologist said that her major concern, Dwight, is that economic interests were prioritized over health interests. And she said that that is both unfortunate and it's also short-sighted, because if we wait longer to put strong restrictions in place, they will end up needing to be more severe, and then they'll end up needing to be in place for even longer.